Hello and welcome to Focus Washington. I'm Art Swift. Today I'm joined by Salomon Chertorivski. Mr. Chertorivski is the head of Mexico's National Commission for Social Health Protection. Previously, Commissioner Chertorivski served as the executive director of DECONSA, an agency in the Secretariat of Social Development. We welcome you to Focus Washington.
Thank you very much.
Let me start by saying the topic of healthcare reform is currently the subject of much debate in the United States. Mexico has the goal of universal health coverage by 2011. So how is the Commission working to achieve that?
Well, we're working very well. After the last financial reform on the health system in 2004, we have been affiliating to the Seguro Popular, as it is called, the insurance for all the Mexicans that do not have any other kind of coverage. And this has been growing exponentially and very well developed. We have today 31 million Mexicans already insured by the Seguro Popular. Our goal for next year, and with a recent reform sent by President Calderon to Congress, and that was already approved by the Cámara de Diputados and will be hopefully approved next week by the Senate. With this reform and with the budget already authorized for us for 2010, on the first semester of 2011, we are reaching the goal of the universal health coverage that would represent 49 million people affiliate to the Seguro Popular, and the rest of the country affiliate to other mechanisms of affiliation. We have to do a very, very strong work next year. We're gonna develop all the strategies to reach, because the people that haven't been affiliated yet are people that live in more far away localities, on rural, very, very far away communities, and we have to go there, reach them, affiliate them, and offer them which are the rights and their benefits as an affiliate to the Seguro Popular. We are sure, and that's the instruction President Calderon have gave us, that we can make this happen, and I'm positive to tell you that on 2011, Mexico is reaching the goal of having universal health coverage.
Terrific. How does the Mexican healthcare system, though, pay for the costs?
It's very interesting because as the Seguro Popular, we keep on saying an insurance, but really what it is an ensuring the financial backup for the medical care assistance for every Mexican in a subsidiary solidarity way by the state. It's really paid by general taxes, and every Mexican is putting a little peso to help the other Mexican who need the Seguro Popular. So almost all the costs are paid by the state, by the federal government, and by the state government. And a very small piece of it, there's a family quota that has to be paid by the families that are not on the most poor families in the country. I mean, a family that can pay, start paying around $70 a year, sorry, for the insured of all their family for the whole year.
Now, Mexico has a system of public and private hospitals, and how do these work together to provide health care for Mexicans?
To tell you the truth, the great majority of the hospitals are public. Okay. There are very, very few private hospitals, and the people that use the private hospitals are the richer people in the country with private insurances. But the vast majority of the hospital network in the country are basically financed and used by mostly three types of affiliation. One is the formal workers that have a social security system with their own hospitals, the workers that work for the state that have another system, and then the people that are affiliated to the Seguro Popular. They use a network of more or less 18,000 hospitals of all sizes all around the country. The people that are affiliated to the Seguro Popular go to these hospitals and they receive all the medical care attention, chirurgical, prevention, all what they need on their medical needs, free of charge. Only by being affiliated to the Seguro Popular, any Mexican that need attention has that attention.
Yes. Well, a lot of your work takes place, obviously, at the intersection of social development and healthcare. How does the Commission work with other social development programs, such as Oportunidades, to provide healthcare to the poor?
You have it completely right. One of our main responsibilities is actually working with other programs. You mentioned Programa Oportunidades, which is the most important program or social development program created, I would say, in the world. The program has been replicated in more or less 16 countries. Here in the States, in New York City, the Programa Oportunidades is working for the urban poverty. The program, what tries to do is to develop basic capacities for the poor. It's a grant guarantee to the family if the children goes to school and if the children goes to a clinic every once and then. Well, that commission that I'm honored to manage, to lead, is the responsible for the health and nutrition part of Oportunidades. Oportunidades has three main components: education, health, and nutrition. Well, that commission has the responsibility to develop all the strategies and serve all the families, beneficiaries for Oportunidades on those components. On the nutritional component, what we do is we have to take care of supplying a nutritional supplement to all pregnant women of the Oportunidades program and to all children of 5 years and younger. They receive this supplement, nutritional supplement, and they have to eat it daily. It has all the multi-nutritional needed for a good nutrition to combat anemia and all the things that are needed. Also, the program, when you receive the grant, you have to develop certain co-responsibilities. That is, for receiving the grant, you have, as I said, you have to go to school and you have to check your absent list, and you have to go to a clinic. You have to get your vaccines. You have as a child, you have to take your children, and it has to be weighed and measured, and to see how the children is developing at his age. And you have to receive some talks of what is good to eat, what is not good to eat, where do you have to cook, because we're talking about people that, for example, cook in their own house, and that can be one of the worst things for the digestive system and for the eyes and for everything. So we give talks for empowering people in order for them to develop the abilities to take the best decisions on their health, on their nutrition. And so, as you can see, the Seguro Popular, that is held by the commission that I lead, and Oportunidades, we're working all together. It's part of the same thing. And hopefully, with the development of capabilities and with the security network that the Seguro Popular provides to the people, we are reaching every day the possibility that more Mexicans have the opportunity to effectively be at a society and to have more possibilities for their children on the future.
You're making progress. Well, on that note, Commissioner Chertorivski, we thank you for joining us. That's all the time we have on Focus Washington. I'm Art Swift. See you next time.